This is Talk Business and Politics with Roby Brock.
Welcome to the program. I'm Roby Brock. COVID-19 cases are spiking across Arkansas as the Delta variant takes root. Low vaccination rates and a laissez-faire response from state elected officials has led to quadruple-digit growth days in cases, and deaths are well over 6,000 now. Children now being affected in a much more deadly way. I caught up with Dr. Joe Thompson, former State Surgeon General and CEO of the Arkansas Center for Health Improvement, to discuss.
All right, Dr. Joe Thompson, Arkansas Center for Health Improvement. We've seen reports of children dying from COVID-19 this past week. This is kind of new territory, and there is a new threat. Why is this happening?
Roby, unfortunately, the virus has now penetrated our younger age populations. More than half of the new infections over the course of the last week have been in people under age 35, and it's reaching down into our teens and younger children. We did suffer the first reported death. We've had a death last year that was also noticed in children. So this now is affecting younger kids, and it's a cause for concern of both parents and school officials statewide.
You mentioned school. School starts in less than a month statewide in the state of Arkansas. This Delta variant is obviously much more dangerous. Should we be changing school policy to allow for virtual classes, to mandate masks in some way?
Well, this Delta variant is more than twice as infectious as the parent virus that we dealt with last year. We're on a steeper infection curve than we ever were last year with the Delta variant racing through our communities. And I think we're going to need to have all tools available for us. Superintendents are worried about their ability to bring kids back in school safely. And we really need to try to get everyone that could be protected with the vaccine protected before we start school or college this fall.
As much as we're calling for that, it's not happening. I mean, you can look at the statistics and tell. So what is going to change behavior to get people that can get the vaccine to get it? And what do we need to do to put precautionary measures in place to protect those school children?
Well, our General Assembly unfortunately handcuffed both local mayors and superintendents by not allowing them to put mask requirements in place for students or in communities that have a significant outbreak. I think we need to revisit that decision because of the threat that we're under. We need to have all of our tools on the table as we go into this fall to avoid a repeat of last year.
The governor has the authority to call a pandemic emergency. The legislature, because of the new law, just has to affirm that, or they can call it off, I guess. But it's still the governor's call to make on a pandemic emergency. Are we at that point? When you look at the statistics and where we are compared to where we were in a pandemic emergency a year ago, is it time to declare an emergency?
We are approaching that point. We have about a third of the maximum number of cases we ever had each day last year. We're at a third this year. The trend line is much steeper than it was last year. If we don't get control of the spread of this Delta variant, or my biggest fear is that with the spread, we're going to have a new variant that is either more infectious or escapes the control of our vaccines, and then we will be back at square one as we were in the original pandemic.
So I'll ask this question I asked earlier, maybe a little differently or a little more bluntly. Should we have a mask mandate for schools? Should we have a mask mandate for businesses?
The American Academy of Pediatrics has come out, and because we cannot protect children less than 12, and too many of those over 12 that are eligible for a vaccine will not be protected, they call for all schools to have masks for all kids. The Catholic Diocese this week decided that all Catholic schools would have masks for school, all grades for all kids. I think we need to have masks in schools when we go back. I would encourage local superintendents to contact their legislature and have a voluntary program with parents if we still are handcuffed and not able to do it by mandate.